Welcome to our podcast today. I'm Megan Kilkeary. I'm a pharmacist with the Compounding Center in Leesburg, Virginia. I am proud to bring you our guest, Jim Paoletti, who is a functional medicine pharmacist. He's been practicing for over 40 years in functional medicine. He does hormone consults. He was a part of ZRT Laboratories for several years. Jim, I'm going to go ahead and let you elaborate a little bit more on your background. But he's here with me today to talk about some men's health issues, which we're really excited to bring you. I think a lot of times when we talk about hormones and adrenal problems and gut health issues, we focus a lot on women. But in fact, men also have a lot of these issues as well. And so Jim is with me and going to do a series of a few podcasts. And today we're going to talk about adrenal stress in men. So Jim, take it away. Tell us a little bit about yourself, and then we'll dive on in.
Thanks, Megan. Glad to be here. Yeah, I've been totally blessed. For two of my jobs for about 20 years, I was in charge of putting on educational seminars, did a lot of seminars on bioidentical hormones, thyroid, endocrinology, nutrition, etc. And being the moderator, I got to listen to some great speakers time after time. And then I was asked to be on the faculty for the Fellowship of Functional Medicine to teach compounding and hormones. And in exchange for not taking payment for that, I was allowed to take the classes. So I took about 8 years worth of classes on weekends now and then, and probably would have cost, another practitioner $50,000, $60,000 to do so. Totally blessed with an education, which I love to use. I'm going to continue to use as long as I'm capable. Okay. Absolutely. So that's my background. I just look for problems in patients and try to solve them. And I'm glad we're talking about males because we don't do that enough. Excited about that.
Absolutely. Absolutely. So, Jim, we're going to talk a little bit today about the symptoms of adrenal stress in men, what causes them, and when some things of how to fix them. When you're doing consults with these patients, what your recommendations are to them. So talk to me a little bit about what are some of the symptoms that you see in male patients that are presenting to you that you find they are stressed out adrenally.
Well, first, let me say I'm so glad we're starting with adrenals. For years, I've talked about, I've educated practitioners on how to do hormones. And I've always said, look, start with the adrenals. Mm-hmm. Every endocrine hormone affects every other endocrine hormone. But if you want the master control switch, it's cortisol. Mm-hmm. Cortisol affects testosterone. It blocks testosterone from working at the receptor. I've seen plenty of men that have a normal or even a high normal testosterone level with symptoms of erectile dysfunction, apathy, etc. And it's because they have high cortisol all day. The symptoms overlap a lot with symptoms low testosterone, low stamina if your cortisol gets low, low libido. High and low cortisol suppresses libido. And like I said, it affects testosterone working, so it can actually cause symptoms of testosterone deficiency. It can cause weight gain. It can cause depression. It just so many symptoms overlap. I don't like the fact that so many people are just addressing testosterone is going to fix everything in men. Right. If you don't fix the cortisol issues, and everybody's stressed, mm-hmm. Males are worse as far as cortisol in my mind in this sense. Women are communicators much better than men. They'll talk about their problems. Men hold a lot in, and that's suppressed stress. I have not seen a male over the age of 45 in at least 2 years that doesn't have some at least mild adrenal dysfunction. The adrenals can only take so much pounding over the years, and then they're not able to kick out the cortisol the way they used to, and you don't have the resilience you used to. So I think it's an issue that should be addressed. I think most men should have their cortisol levels checked. Mm-hmm. Right up when they do the testosterone and thyroid we're going to talk about, look at the whole picture because every one of these hormones is affecting your symptoms.
Right. I also know as far as testing goes for cortisol, I know you are a big fan of a 24-hour cortisol test. I know a lot of practitioners out here will only do a single time point in cortisol, but I know you feel it's very important to get a big 24-hour picture of cortisol levels. Talk to me about that.
I prefer to test cortisol 4 times a day. In my 40 years of experience, I have seen numerous times where morning cortisol is normal. Mm-hmm. Okay. Well, where does it go the rest of the day? Could go low the rest of the day. Could go low during the day, high at night. Could be high all day. That's what counts. You can't go on a single cortisol. I've seen doctors that order cortisol morning and night. Well, those can both be high, and then you're treating high cortisol. But if the patient's low during the day, you're going to actually make the patient worse.
Mm-hmm.
So you need to look at the cortisol pattern throughout the entire day, along with DHEA. That's really important to assessing adrenal function. DHA is made 100% in your adrenal glands.
Mm-hmm.
If you're low for your age on DHA, you have an adrenal problem.
Mm-hmm.
So that's what we do. It's called an adrenal stress profile. If we just want to look at the adrenal function, we'll do cortisol 4 times a day and DHEA.
Right. So as far as causes of adrenal stress in men, I know you touched a little bit on it. Men aren't great communicators and will internalize stress more so than women. What are some other things in your practice that you have seen, men
Everything.
come to you? Yeah.
Everything. Financial. Men feel responsible for taking care of their family. So there's always that pressure. Am I doing a good enough job?
Mm-hmm.
Job situations, marital relationships,
Mm-hmm.
children, relationships, and how are they doing? Guilt,
Mm-hmm.
and environmental toxins. There's just so many stressors in our life. What we don't do today is we don't have time to offset the stress.
Mm-hmm.
Pre-industrial revolution, what did everybody do? At lunchtime, we shut down the world. Every business closed. Everybody went home for an hour and a half to 2 hours. You spent time with your family, you relaxed, you had a meal, maybe a little nap, and then you went back to work. And we didn't work third shift. We didn't work constantly. Nowadays, especially younger people, you take a 25-year-old cell phone away from them, and in 10 minutes, they're in a panic,
Mm-hmm.
which means what? They don't have any downtime. We don't have enough time spent to offset the fact that we're stressed so much.
Mm-hmm.
So it's uncommon to see patients over the age of 45 that don't have some HPA axis or adrenal dysfunction. It's a way of life anymore.
Mm-hmm.
And I'm scared to think what the future holds, because these younger patients, they're stressed out and anxious and at a much younger age than we used to see.
Right. So somebody comes to you, a 45-year-old plus patient is coming to you, and you do a 24-hour saliva cortisol on them, and you get their profile, and you see that they are completely out of whack as to where they should be. What are the first steps that you take or that you recommend to these patients to get their adrenals working again properly?
Well, it varies with each individual, depending upon their test results and their symptoms. But in general, there are changes that take place in the brain and the body when you're under stress too long. The cortisol is a stimulant hormone, so the brain gets used to it and it wants more. So we have to figure out how to get cortisol output regulated back to normal. We've got to figure out how to get the brain to stop overreacting to stress. And then the adrenals are highly nutritionally dependent. There are a list of 20 some vitamins and minerals that the adrenals need to function properly. If you're going to pound your adrenals with stress for a number of years, you're going to deplete those vitamins and minerals, and your energy is going to go down. That affects the Krebs cycle, ATP energy production. So we attempt to restore or replete those vitamins and minerals that are most likely deficient. For an example, one of the ones most commonly depleted when you're stressed is magnesium. And magnesium is, think of relaxation. You think magnesium, it relaxes the blood vessels, the brain, nervous system. It helps with sleep. I can't tell you how many people come in with cortisol issues, and one of the things that helps them sleep better than anything else is put them on some magnesium, get that back up to a good level. So, but we'll look at the complete list, and depending upon where their energy level, there are different approaches as to how extremely you want to support that at first. But I do want to mention that all the things we do for adrenals, the attempt is to restore normal adrenal function, normal stress response, normal cortisol output. It involves lifestyle changes, nutritional supplements, no prescriptions required. And it's all meant to be temporary. It isn't long-term. Well, depends on how you define long-term. You can fix adrenals, get back normal function anywhere from usually 3 or 4 months up to maybe a couple of years if they're under a lot of stress. But the long-term goal is, look, you shouldn't have to take supplements. You shouldn't have to do these daily lifestyle modifications. Let's get your adrenals back to normal. And in that process of getting there, I'm going to teach you how to keep them there.
Mm-hmm.
You don't have to keep taking supplements the rest of your life.
Right. Absolutely. So besides magnesium, is there anything else that you normally recommend for these patients? I know there's a lot of options out there on the market, different adrenal stress formulations. Some are made with bovine or pig glandular products. Some contain supplements like ashwagandha. Is there anything that you like to piggyback on with magnesium for a lot of these patients?
Oh, there's several things. First of all, you're going to have to use adrenal adaptogens because the brain's overreacting to stress if you've been stressed for a while, and you need to calm that message down for a while you teach your brain not to overreact. And those are things like the ashwagandha, holy basil, Siberian ginseng, Eutheria, maca, licorice. There's a whole list of them. I usually use a combination of 3 or 4 different ones in patients, again, anywhere from 2 to 6 months usually. That's going to help calm down. They blunt the message that's going from the brain to the adrenals that you're stressed. So you get a more appropriate stress response, which is really important. But it'll help people sleep, help relax them, puts them in a better mood. But I separate a lot of the products that are out there are combination products. Everybody wants the adrenal pill. It's got a little bit of this, a little bit of that, a little bit of that. I don't use a lot of those because what I see in the combination products is often subtherapeutic doses of the adaptogens. Not enough. They got 3 in there, but there's not enough of any of them to be therapeutic. There are people that like, as you mentioned, they throw glandulars in a lot of these combination products. There are people who don't need the glandulars. If you're not really low on cortisol, you don't really need the glandulars, and you can get wired on those. So you can't get enough of the adaptogens without getting too much of the glandulars. I separate things out. The vitamins and minerals I look at, depending upon the person's individual energy level, helps me determine if they're really fatigued. I'm going to put them on a special adrenal vitamin that's got the vitamins and minerals they need to replete now. And if they're taking, I'd like them to take a regular multivitamin mineral, a good one, because that fulfills your systemic needs. What we need to look at here is we need to fulfill your systemic needs, maintain everything. At the same time, I need to replete your adrenal vitamins and minerals that you need. So we'll do the adrenal supplement in addition to a daily multivitamin for a period of 3 to 4 months usually, and then start tapering off that. But what specific products I use, again, depends upon every individual's symptoms and their test levels. So you fine tune it toward the individual, and then you see how they respond. You tweak things as we go. Tweaking is such an important part of this. People have to understand it. You can't come in and do a consultation with me and have me have the magic answer that works for everybody. Everybody's so different in their response.
Right.
So I do follow-up consults every month for as long as needed to make sure we're tweaking and getting that individual back to normal adrenal output.
I know we're going to do some additional podcast talk on thyroid and testosterone as well. But lead me into those, because you did say that, the adrenals are kind of, at the top of the food chain, and you have to start with them and fix those. So tell me a little bit, just as a teaser into some of our other topics, how do those adrenals flow into these other systems for males?
High cortisol suppresses thyroid function. Low cortisol suppresses thyroid function. High cortisol blocks estrogen, progesterone, and testosterone from working the receptors. Cortisol is closely related to insulin resistance. So if your cortisol is bouncing up and down, going too low, then insulin's going to go too high. If it's going too high, insulin's going to go too low. So like I said, cortisol is the master switch. You got to control it. And the symptoms of high cortisol can mimic symptoms of low any other hormone because it interferes with all of them. So yeah, you have to take a look at the whole endocrinology system at once. You can't go in and fix one thing. You can't, in females, go in and fix estrogen and progesterone and have them feel good. You can't fix testosterone in a guy, ignore the thyroid and cortisol and the insulin. It's not about just getting the right level of the hormone. It's having it be functionally optimal. Okay. That means you have to fix the other hormones that are interfering with its activity.
Great. Well, Jim, this has been really informational. So thank you for, what you've presented here. And we're going to talk a little bit more in some other episodes about testosterone function in males and also about GI health and thyroid. But like you were saying, I think it's important to always look at the adrenal function picture going on here. And if your physician is not adequately looking at that and responding to that, then everything else you're trying to fix further on down the line is not going to work. So thank you for that, the great information in there and that reminder. So.
Oh, thank you.
All right. And thank you so much for tuning in to the Compounding Center's podcast today with our host, Jim Paoletti, on adrenal function in males. Stay tuned for additional podcasts. We're going to, like I said, talk about thyroid and testosterone function. If you have any questions, our email addresses are going to be in the info link here. Feel free to reach out to either one of us, and we hope to hear from you soon. Take care. Thanks, Jim.
Thank you. Bye-bye.